What's up everybody, it's Ryan Nord. I'm an ENT specializing in treating sleep apnea. If you watched my previous video, you already know the 5 questions that you need to ask yourself before you get an Inspire consult. This video kind of flips it around. I'm going to give you the 3 things that you need to go into this consult to be prepared to ask the right questions. Once you've decided to go to your Inspire consult, how should you prepare? It's kind of a big deal. Do you have a list of questions? What do you need to ask? And that's really what I'm going to talk about today. But I think these are the 3 things that you don't want to leave that consult without knowing. It's time for your Inspire consult. You go to the doctor, you sit down, they come in, and then your mind goes blank. What was I supposed to ask? I'm not prepared. Well, I'm going to help prevent that for you today. The number 1 thing you got to ask is about experience. What's that surgeon's experience? Have they done none of these? 10? 100? I think that's important, right? I mean, the more you do things, the better you get at them. And that's just kind of a natural learning process. This surgery has a learning curve, just like anything. And I'm not saying you shouldn't go to somebody unless they've done hundreds of these procedures. But I do think it's important to at least know what your surgeon's experience level is. Think of it like this. I'm kind of a car guy, so I used to have this Subaru that I thought was the coolest car in the world. And I wanted to go, make it go faster. Who should I bring this to, soup it up? Do I go to the local mechanic down the street? No. I did my research, and I found the person that only works in Subarus. That's all they do all day long. And, well, it didn't make my wife too happy, but I was thrilled with the results. If you're gonna do that for your car or anything else, wouldn't you do that for your surgeon too? So how do you ask your surgeon about their experience? Well, my patients ask me this all the time, so don't feel bad about it. They'll ask me straight up, how many have you done? Show me your results. And so for me, after doing 175 or so of these procedures, I can tell them it's going to decrease your sleep apnea severity by 70 to 80%, and tell them that I've learned a lot of lessons and I know how to minimize any of those risks. So ask them, how many have they done? What are their results and what complications have they had? The next thing you want to get a handle on is called the timeline or the care pathway.
Here's my quick overview of the Inspire Care Pathway. We've already discussed patient screening. Next is going to be the drug-induced sleep endoscopy, which is a quick airway exam performed under sedation to see if you're a candidate for Inspire. After this, we'll submit everything to your insurance and get you ready for the Inspire procedure, which itself is an outpatient 2-hour surgery. 30 days after surgery, you'll get the device turned on. This may be with your ENT or your sleep medicine doctor, and the Inspire rep may also be involved. 3 to 4 months after surgery, you'll have your titration study. This is typically done in the lab, and this is the sleep study to determine how well the Inspire procedure worked. Most of the time, it's going to be done in the sleep lab, but sometimes it'll be a simple home test. Finally, there's long-term care management. We can follow your progress by looking at the Inspire Cloud and see how well you're using the device. It should be noted that we can't tell how well the device is working based on this data, and that's why the sleep study is so important.
And so that whole pathway, you want to know how is that going to work with this particular practice, because it really does vary from place to place. So now you're probably seeing that the surgery is just a small part of this whole process. From the consult to the sleep study, that could be a 6-month or longer process. But 6 months is not too long to wait to be able to sleep better than you have in a long time. The third thing I want you to ask is about communication. It can be hard to reach doctors. We're so busy, we got so many things going on, but you do need to know how to reach your doctor or someone in your doctor's practice. Personally, I give my patients my email address, the phone number of our nurses, and the number of our Inspire rep. Beyond that, there are numbers on the Inspire's website, 1-800-OSA-HELP, which you can reach 24 hours a day for simple questions, like, why is my remote not working? You gotta check the batteries. Or, how do I turn this thing on? Hit the green button. Things like that. Whatever it is, you can ask these questions. You won't be left in the dark. Well, I hope you enjoyed this video, and now you have 3 questions to ask your surgeon so that you go into your procedure feeling great. That's it for now. So long and sleep well.